Why is it important to become your own best advocate? We at Myeloma Crowd have brought together a whole team of myeloma specialists and patient experts to deliver these videos to you. All the patients you're about to see are myeloma patients and expert patient advocates who have learned the importance of advocating for themselves firsthand. The doctors are some of the top doctors in myeloma, and they are able to see what the best patients do to take control of their care and advocate for themselves effectively. It is so important that you become educated about your myeloma and participate actively in your care. I'll let our experts explain why that's the case.
It's hard when you're first diagnosed with myeloma because you have this disease you never heard of before. Everything's new and you're thinking about every aspect of cancer, like from your finances to your family situation, and it can be really overwhelming. But when the dust settles a little, you're going to start needing to make some important treatment decisions. And to make those treatment decisions in conjunction with your doctor, you're going to need to be as educated as you possibly can. Patients who become their own health advocate, I think, live longer with multiple myeloma. They ask better questions of their doctor in the clinic. They are aware of the different treatment options that are available to them. And because they're advocating for themselves, I just notice how busy healthcare practitioners are. The nursing staff, the physician's assistants, the doctors, they're being asked to do more in less time than they ever have. And sometimes it's just not possible for them to keep track of every little detail for every patient. They are doing great and amazing work, and they are really caring and brilliant people. Just sometimes it's best, if you're going to get the ultimate outcome for yourself, that you self-advocate.
Well, personally, I think that patients who come in with a lot of foreknowledge end up getting more value out of consultations, are able to intelligently participate in the decision-making process because it's not always black and white, can be in a better position to discuss whether they wish to participate in a clinical trial. And I find it highly valuable. Moreover, patients who are educated usually bring with them to the consultation all the necessary information that I need to make an intelligent recommendation. And so instead of spending the time for our visit trying to dissect the course of their disease and understand where they've been and how they've been treated, we can focus on the questions that they want to focus on so they get the maximum value. I'm always appreciative when patients come in with a list of questions, when they really know a lot about their disease, even when they bring in manuscript journal articles about new treatments where we can discuss that with them. I think the patient gets much more value out of it, and I think we'll have a greater satisfaction with what they've learned. I think patients who come in and say, "It's whatever you say, doctor," don't always get the optimal value that they can get. Patients who are educated can ask probing questions and really participate in their care in a meaningful way, which I believe actually improves outcomes.
Myeloma is a very heterogeneous, difficult disease. To learn about it, you really have to study it. And to become your own best advocate, you have to know your enemy. The reason for doing that is to make good myeloma treatment decisions. You can work with your doctor to improve your treatment if you advocate for yourself, know what's possible with myeloma treatment, and ask for what you need. Tell your doctor if you're having concerns and problems. You need to be an advocate for yourself. No one understands your health, your situation better than you do.
I was diagnosed with myeloma a long time ago, 1995, and certainly treatments have changed a lot in the last 24 years. I think it's so important to become your own best advocate for that reason. Treatment for myeloma is not a one-size-fits-all. In fact, even for a given individual, there are treatment options. The more you understand about myeloma, the more you understand about your own myeloma markers, possibly side effects that can come, the more and better questions you'll be able to ask your doctor so that together you can determine the next best treatment for you.
What you don't know can hurt you. The more knowledge you have, the better you are at making the appropriate decisions. And it's whether you as an advocate do it or whether you have somebody like a child that takes the leadership role and learns all about the disease. But what I found is that those people who have the most knowledge of this disease seem to do the best. And I think that's probably some of the very important reasons that you need to be your own advocate, because you won't find these things out by yourself unless you do research.
I think the most important thing for a patient is to really know their disease, know the side effect of the treatment, and know why they're being treated and how we're going to measure the outcome. The more the patient knows about the disease, about the treatment, and about the side effect, I think the better they are going to do, because it's a partnership. I can give a drug. I know what the side effects of the drugs, but I don't experience those side effects. Somebody has to tell me. And I think the most important thing today is that quality of life. We have made a progress. Patient 20 years ago used to live 2 to 3 years. Now a patient living 10, 15 years and longer. But you want to live quality life. And I think if you are engaged with your physician and you're really seeing the right physician, because I think myeloma patient deserve to be seen by a specialist, and at least once or twice a year, in addition to their oncologist, so they can navigate this very complex disease and this complex treatment regimen. Now we have, it's an amazing time because we have tons of drugs, tons of options. We just have to use them in the right combination at the right time to prolong survival and prolong quality survival. And we cannot do it without the patients and their family, because I think they are the one that dealing with the disease, taking the treatment, dealing with the side effect. So they need to know their disease, and we need to help them understand their disease and their treatment.